You just sprained your knee doing something you love. It's obviously paddle tennis, but relax. We'll guide you through the recovery process. The structure most likely to be injured is the MCL, the ligament on the inside of the knee. It can be divided into 3 different grades, and in this video we'll be looking at grade 1 sprain, where the research is in favor of conservative management. Estimated recovery time is around 2 to 6 weeks according to research. I would recommend visiting a physiotherapist. If you fear you have either grade 2 or 3 sprain, in the early stages you want to control the swelling first by avoiding making the pain worse. Icing is an option if you think that will help relieve your pain. Secondly, you want to regain range of motion in knee flexion and extension. Here you can pick any of these exercises that suits you. Thirdly, you want to maintain quadricep strength to aid your recovery. You can choose either of these 2 exercises. Once you have achieved full extension of the knee, you'll want to gradually start walk again. Second stage, focus on improving strength, balance, and exposure to rotational forces to prepare you for a return to sport. Exercises are categorized with a structured progression. The first category is the split squat progression, starting with the bodyweight squat and progressing all the way to an elevated split squat. You should move on to the next exercise when you can do 2 to 3 sets of 15 repetitions with minimal to no pain. The second category is the lateral step-down progression, which is more difficult than the first category as it places more emphasis on one leg strength and balance. Again, once you can do 2 to 3 sets of 15 repetitions with minimal to no pain, you want to move on to the next exercise. Third category is the leg extension progression, which is crucial for isolating the quadriceps. Start with isometric leg extension and progress to full knee extension when comfortable. Focus on these main exercises, but also include movements that target the hip and knee muscles in different ways to promote knee stability and strength. You can include one group of 3 exercises in one workout and then a second group of 3 exercises in the next workout. In the final stage, you want to incorporate dynamic balance, running, plyometrics, and rotational exercises for gradually returning to your sport. This can take a few weeks, so be patient. Once you have completed all the previous progressions, you can gradually return to your sport, with the main criteria being no pain or discomfort and feeling mentally ready. Phase 1 is minimizing pain, restore range of motion, maintain quadricep strength, and resume running. Phase 2 is building up strength and capacity. Phase 3 is return to sport, emphasizing plyometrics, straight and lateral running, and rotational movements. Here is an example of a training week in the early stage. You want to perform the exercises every day, and even multiple times a day if possible. Here is an example of a training week in the later phases. You want to perform these exercises at least 2 to 3 times per week.